Respected chairpersons, teachers, seniors, and dear colleagues. So far, all the talks were for the fitness of the patients, for patient care. But this talk is for the doctor's health. So the disclosure, some strategies of this talk are based on scientific studies, and some based on experience of the fitness communities. The doctors are a vulnerable population. Mostly they are desk-bound. Majority have inactive lifestyle, lack exercise for the majority, high percentage of stress and depression. There is high obesity also, and although they recommend periodic health checkup to others, they never undergo periodic health checkup. And there is sleep is mostly disturbed due to night calls and all. And the result is the life expectancy in doctors in India is 59 years. It is 9 years less than a non-doctor. So to the doctors, I have to tell that doctors, please heal thyself before treating others. So the pillars of physical fitness, there is nutrition, exercise, and sleep. Just a question, and I will answer immediately. What is the organ of longevity? And most of in the fitness community, it is the organ of longevity is considered as the muscle. And another question: name 2 organs in our body which protect us from lifestyle diseases. One is muscle, and the other one is gut microbiome. So I am discussing some 10 strategies for the upliftment of the health of the doctors. So first is protect your gut microbiome with dietary fiber. Gut microbiome consists of bacteria, fungi, and viruses, and mostly concentrated in the large intestine. Number of cells in our gut microbiome is more than the number of cells in our human body, and 99% of genes we are carrying in the human body do not belong to us. They belong to the gut microbiome. So one good thing is about that, this gut microbiome we can modify by lifestyle changes. The functions of gut microbiome, metabolic function, the immune function, they produce all variety of vitamins, and they are even capable of synthesizing all amino acids. The famous bodybuilder Arnold Schwarzenegger, he is a famous actor also. He takes about 80 to 90% with pure vegetarian food, almost all vegan foods. But he has enough, he has built his muscles so that there is a thesis that all the amino acids can be synthesized in the gut microbiome, even with vegetarian food. So there is a gut-brain axis, that is neural, hormonal, and immunological signaling between the gut and the brain. It is said that when gut speaks, the brain listens. This was told by this gentleman, Hippocrates, 2000 years back. All chronic illnesses probably has origin in the gut. The fiber requirement in a men is 30 to 40 grams, and a woman it is 25 to 30 grams, and seen only in plant kingdom. And fiber is the fuel for the gut microbiome. The fiber content of some goods, mostly it is pulses has high amount of proteins, then nuts and fruits, but the rice is having very low amount of fiber. What SAD, heard of SAD? SAD is the standard American diet. It has only 12 grams of fiber, and 50%, more than 50% people more than 75% people above 50 years have insulin resistance because of the low consumption of fiber in US. And most of us are also fiber deficient. So how to improve gut microbiome? The fuel for it is fiber. Fiber-rich food is the mainstay. Other methods, fermented food, polyphenol-rich food. You can use limit processed food and added sugar. Consume healthy fat. Consume healthy fat like avocado, olive oil, nuts, and stay hydrated and mindful of antibiotics. These are the methods to improve your microbiome. Second strategy is protect your muscles. This is a muscle of longevity. Two things are there. One is adequate protein intake. Second one is strength training. These two things can only protect your muscles. We'll concentrate on the protein intake. Protein requirements are, as we know, 1 gram per kilogram body weight for normal people, and for athletes and bodybuilders, it is higher. And these are the food items rich in protein: pulses, milk preparations, fish, egg, and meat. If you are a non-vegetarian, you can easily meet the requirement because beef, mutton, chicken are having 27 grams per 100 grams, and so also fish. But if you are a non-vegetarian, you have to plan to get your adequate protein. You have to take a lot of pulses. You can put cheese products, cheese and milk products has to be increased to meet, and nuts has to be increased to meet the required protein. And protein content of fruits, as guava is having very high protein content, 4.2 grams per cup. And rice, it is lacking in enough protein, only 2.7 grams in 100 grams. And chapati, 1 6-inch chapati is having 4 grams. Millet is having slightly higher protein. So the message is you take a plan accordingly, take non-vegetarian food, or if you are taking vegetarian, and plan and take enough proteins to protect your muscles. Third one is concept is junk food. This is defined as the food that is high in calorie from sugar and fat or possibly sodium, but very little dietary fiber, protein, vitamins and minerals. And this belongs to Pepsi, jalebi, ice cream, pudding, sweets and junks. These are junk foods. And egg and avocado. One egg is having only 70 calories and it is having 6.5 gram proteins. So it is have a high nutritive values. So also avocado. These are junk foods. And the other junk foods popularly eaten, but it's still junk. Suppose you take rice, chapati, idli, appam, dosha, white bread. We are taking this. These are also junk food. High caloric value, poor nutritive value. You take 100 gram of rice. It is more than 400 calories, only fiber deficient, protein deficient. So also dosha, idli, vada, appam, and all these are, if you are taking alone, it is a junk food. Ideal place should be vegetables plus fruits 50%, 20 to 25% proteins, and the rest only grains. In diabetics, we have to be half plate vegetables as IMA proposed platil padi pachakari. So coming to the strategy for intermittent fasting with calorie restriction, as we know during the evolution and all, except the last 50 or 100 years, we were taking very little food, maybe a seasonal fruit and some tuber, maybe some meat and all, and that is only once in a day. Then they will take in the next day only. But last 50 or 100 years, there will be 3 meals, 4 meals, 5 meals like that, so that we got an accessory organ called kodavayar. And the main reason was this insulin resistance. Because of the high carb frequent diet, there are sugar increases, insulin goes up, insulin stays for about 6 hours. By the time insulin comes down, ghrelin, which is the hunger hormone, it goes up. And we feel hungry, we take again food, and the insulin again goes up. So insulin is always elevated, leading to insulin resistance. And insulin locks the fat. When the insulin is there, insulin is high, you cannot use the fat. So insulin is locking the fat. So intermittent fasting can overcome the insulin resistance as well as fat adaptation. When you after 6 hours, if you feel hungry, if you don't take food for 1 hour, the hunger will go. Then there will be fat adaptation, fat mobilization. Fat can be used as the calorie, as the fuel. So these are different fasting: 16-hour intermittent fasting, alternate day, weekend fasting. You can have 1 meal a day, and prolonged fasting. Some communities in Germany, that is Buchinger Wilhelmi, they fast up to 3 months. They take only some vegetable soup. It is only 200 calories, and they can survive, and they are not having any lifestyle diseases. So benefits of intermittent fasting: weight reduction, improved lifestyle diseases, autophagy, activate stem cells. If 24-hour fasting can activate intestinal stem cells, improve immunity, improve gut microbial action, improve testosterone, and growth hormone will be increased. If you fast for 36 hours, growth hormone will be increased by 200%, and reduce leptin. And the main benefit is through autophagy. Your body uses itself as fuel, clearing up all the junk. So this person, that Yoshinori Osumi, he got a Nobel Prize in 2016 for describing the mechanisms of autophagy in intermittent fasting. So strategy 5 is aerobic exercise. We know there are 5 types of exercise: aerobic, strength training, that balance exercise, flexibility, and agility. And most of the studies are in aerobic and strength training. 3 fitness parameters which predict increased longevity. One is VO2 max, and second one is resting heart rate, and third one is grip strength. The first 2 are related to the aerobic exercise. Third one is related to the strength training. And how to increase the grip strength? This is called dead hang. You can hang on a bar. On general population, only 5 to seconds they can hang on the bar. But you can increase this by regular training in the strength training, and it can go up to 1 minute, 2 minutes, 3 minutes, like that. This is another method, gripper. You can use the grip to increase your grip strength. The benefits of the aerobic exercise: there is a feel-good factor, and there is a break from the daily routine and stress. And long-term benefits, I need not talk to you about that. Reduce heart disease, reduce cancer, reduce blood pressure control, diabetes, LDL reduction, lowers body fat, increase stamina, reduce osteoporosis, and even reduces osteoarthritis. Even in marathon runners, it is found that they have osteoarthritis less than the general population. Then adverse effects are: one is overtraining, because of the well-being. They are like, some people are likely to do overtraining, and there can be muscle loss in some people because without adequate protein intake. Strategy 6 is strength training and resistance training. And fitness is 80% nutrition and 20% exercise. You can outrun your fork, it is seen. Body recomposition. In strength training, what happens is body is recomposed. Suppose we are having 100 kilogram and doing aerobic exercise, dieting and all, you reduce to 50 kilogram. But the fat percentage and muscle percentage will not change. Suppose fat is 30% and muscle is 20% when you are 100 kilogram. And when it is 50 also, it will be same, 30% fat, 20% or less muscle. So you are in strength training, the muscle percentage can be increased, and you can recompose your body. And when the muscle is more, it has more, it is a costly organ. It burns a lot of calories, and it is very easy to maintain your weight after that. Strategy 5, balance and flexibility. When you near 50 and more, you need definitely balance exercise and flexibility exercise to keep your joints supple. And some of the 5 balance exercises I have shown, I will not go into detail. And these are some of the flexibility exercises which are suggested. It can be done in few minutes. And strategy 8 is non-exercise physical activity, popularly called NEPA, informal or unstructured physical activity. On an average, it burns about 15 to 30% of the calories. And strategy 9 is even consultation room. If you are not able to get the time to exercise properly, you can use your consultation room. Stand up after each patient and then walk to the door and do some soleus push-up in between. You can do, if you have 10-15 patients, you can do 300 soleus push-ups. You can do the gripper. You can do these things can be kept in consultation room. In between patients, you can do that. So if you are not getting time, you are seeing so many patients, you can do this. And last strategy is sleep. We know that NREM and REM sleep. Then there is stage 1, N1 and N2, which is light sleep, and N3 and 4 is deep sleep. And deep sleep is the time where we rejuvenate. That is the in youth they have enough deep sleep so that that is the fountain of youth, and they have that energy because of that. And lymphatic system of brain, waste dumping system, works most efficiently in which stage of the sleep? It is deep sleep, N3, N4 sleep. And deep sleep is affected in old age, all dementing illnesses and psychiatric illnesses. And this is you need not do a polysomnography to know the sleep cycle. You can do it in the fitness watch. This is Apple Watch showing the deep sleep percentage and all. Ideally, we need 1.5 to 2 hours of deep sleep. So, role of sleep: consolidation of memory, efficient function of the lymphatic system. Sleep deprivation can increase MI, reduce testosterone and reduce immune function, modulate gene activity, as well as even 1 day lack of sleep can produce beta amyloid accumulation leading to dementia over years. So, natural killer cell activity reduced by 70% if you sleep only 4 hours in a day. How to improve sleep? These are the methods to improve sleep: exercise, be consistent in time, avoid light exposure and blue light exposure, and comfortable environment, and avoid stimulants and manage stress. So, 10 commandments to the doctors and healers. 1, protect your gut microbiome, take adequate fiber, respect your muscle, adequate protein intake, avoid junk food, and utilize intermittent fasting to reduce your insulin resistance, aerobic exercise as recommended, strength training, recompose your body, and balance and flexibility exercise. Spend time for that, and up your NEPA and NEAT, and consultation, meeting, and travel. You can do some exercises if you are not getting other times, and sleep. The deep sleep, 1.5 to 2 hours, can rejuvenate you. And to conclude, to heal the healer, implement at least 3-4 commandments. Our fitness improve by leaps and bounds, and we will be able to heal more and more people. Thank you.
Thank you, Dr. Manikandan. That was an excellent talk. We spent most of the time explaining to the patient about diet and exercise. We really understood the sleep and splitting of exercise into endurance, strength, flexibility, and balance. In diet, I had a question about alcohol. You didn't mention anything about alcohol, conveniently.
Alcohol, it can, if you 100 people start alcohol, a lot of people go for addictions. That is there. That is, if you limit to the recommended, maybe limiting 1 or 2 portions and all, that will be useful. And you take occasionally, that is okay. But most of them go to the higher levels, and daily consumption will produce family problems, health problems. So I think you have to, you can master the alcohol, you can use.
Thank you, sir. One more thing apart from alcohol, everybody has concern about ഏറ്റവും കൂടുതൽ കുറ്റം പറയുന്ന സാധനമാണ് ഈ മുട്ടയുടെ മഞ്ഞ. ഈ മുട്ടയുടെ മഞ്ഞയുടെ റിയാലിറ്റി എന്താണ് ഇപ്പോൾ? Because many people ask whether we can take egg, can we take the yellow of the egg? So what is your opinion? For
general population, you can take anyway. It is already we have taken, you can take egg, general population can take 5 egg yolks per week, like that. If you are having CAD or a lot of risk factors for CAD, you have to limit according to the level. If you bring down the LDL, and then you can then consume accordingly. It is not contraindicated anyway.
Thank you, sir. It was an excellent speech. Just one word about your word about keto diet. Because now it is a fashionable word, and most of our patients come and ask whether I can have keto diet. I have some diabetes and previous history of CAD. So what is your take on advising cardiac patients for keto diet?
I think this short period of keto diet may be useful, but for long period usually it increases morbidity, mortality in long-term studies. Maybe short 4 weeks, 8 weeks, it can be tried, but not long-term.
Okay, thank you, sir.